Welcome back to Viewpoint. Later tonight we'll hear from the Chief Minister and the leader of Together Gibraltar. We're speaking to the Acting Medical Director about recent difficulties at the primary care centre concerning the availability of GP appointments and the effectiveness of the PCC telephone system. Dr Krish Rawal has told us many GPs have had their leave cancelled and are in need of taking some time off to rest and recover. We're speaking to him about the difficult balancing act of managing both the need for healthcare professionals to recover, but also the need to address the backlog in the delivery of healthcare services resulting from the pandemic. If we adopt again the healthcare user's perspective, what concerns do you have about the impact that the backlog that the GHA has to deal with? What concerns do you have about the impact that that backlog could have on individuals' diagnoses and also on their treatment?
Well, we have to bear in mind that over the last 12 months, people have been very good at listening to the advice, which has primarily been stay at home. We've had obviously the isolation and the stay at home messages, which has been quite right to control the pandemic. But also the message has come out really, be careful when you come to the health service. Try not to come. And also people have been very afraid to come because they don't want to catch the COVID and become unwell. So in that time, in 12 months, of course, there are inevitably going to be people who have developed new medical conditions or had a medical condition that's essentially not been seen. There are also many, many medical conditions which actually you may not know that you've got. Many people who suffer with high blood pressure, we talked about that already, didn't know they had it in the first place until randomly they went to a pharmacist, or they came to their GP for something completely unrelated, or they came for a surgery which unrelated and was told they had a high blood pressure. Same for people with diabetes. Sometimes nobody knows they've got it. Same for certain cancers, for example. There are certain cancers you've no idea you've got them until you come for a routine screening or whatever that thing is. So inevitably in the last 12 months there will be people who may very well have either developed a new medical condition that they essentially don't know about, or have something that may have got a little bit worse because in the last 12 months we've been unable to provide, we've been trying to keep people safe, and perhaps people haven't come because they didn't want to come, quite rightly actually in many cases, understandably. So there is a worry that there are a number of medical conditions that are there that we don't know about, and that's part of the reason why we are working so hard to try and catch up as quick as we can, because the longer we leave it, obviously the worse potentially it could become. So the sooner we catch up, albeit that's a big task, and the sooner we start picking up the people who don't know they have a medical condition.
The current system asks somebody, or everybody, requiring or wanting to see a GP to call at the same time in the morning, which suggests that there are likely to be bottlenecks and people's experience will. Yeah. Is that the best system that we can offer, and why is it not possible to offer advanced bookings for people who know that they need to, or think that they need to see a GP but don't need to necessarily see one today?
Absolutely. So, we over the years, there'll be many people listening and watching who will remember the many different kind of nuances and systems that we put in place, particularly in primary care, perhaps because that's what we're talking about in terms of accessing appointments. And it's been everything from the first of the month turn up to the MyGHA, which is our automated telephone system, to just phoning randomly at any particular time. The difficulty, of course, is when demand is high. The chances are in the morning everybody's going to phone in, and so if you wait till the afternoon thinking, well, the phone lines are still open, you wait till the afternoon, the appointments have gone. So for on the day in particular, it's impossible. You could spend every single day on the phone and not get the appointment that you need. So we're changing the configuration a little bit. We're going to start providing more face-to-face, or better in terms of face-to-face, as of next week, or we're starting and then as of next week, but we're also starting with advanced appointments as well. Because that's something that somebody wants. So if they're saying, I don't want an appointment today, and not only do I not want an appointment today, but I don't want to wait on the phone for 30 minutes to be told there is no appointment, I don't mind waiting on the phone for 30 minutes as long as I'm told, okay, you can have an appointment next week, then that's fine. I just want an appointment. And most people don't necessarily need to be seen on the day. So we are bringing in advance appointments from next week as well, and that's something that will come through on a separate announcement from primary care, just to give people the idea of how to access those, and how many we have, but we need a combination of it all.
What about repeat prescriptions? How are you asking people to deal with those at the moment, healthcare users?
Yeah, so a lot of people have got used to the repeat prescription service, which of course was one of those things that we, if people recall, we had pre-pandemic. You would turn up with your final prescription, you would go to the counter number 5, particularly in the old primary care, for example, give in your old one to show that you needed some more, and then that would go through a kind of an administrative process with your GP to produce more. So we've adapted that throughout the pandemic, so that you can request either by calling through on your normal 52441 number, or through an email address, which is prescriptionrepeats@gha.gi, and request your prescription. And essentially what happens now is that is processed by a GP. So we're very keen always to have a medical input into those repeat prescriptions, because actually if nobody's monitoring it, then it sometimes could seem very convenient to just repeatedly ask for your blood pressure medication or your diabetes medication or whatever that medication is you need again and again and again and again, and you could very easily, because time tends to slip away, find yourself 2 years down the line not having actually seen anybody to check whether you're on the right medication, whether your blood tests have been checked, whether your blood pressure is controlled or your sugar is controlled, or all of those things that go with it. So we always make sure that a GP is involved in that process. So you make your request essentially remotely, primarily. The GP will look at that, they will check your records, make sure that you're in date since the last time you were contacted by telephone or seen, depending on when you were last had contact with primary care, whether your blood tests are required or whether in date, whether your results were normal, before they will issue that. And now we run a system where that is issued, that prescription, repeat prescription, and then those prescriptions are sent to the pharmacy of your choice. And if you recall, in the past, you'd have to come and collect it yourself and take it to wherever, whereas now it's sent to the pharmacy of your choice, where you can then at your convenience just go and collect it. So it's a great system. It's a really good system, but it still needs a GP's input.
Okay. In respect of dental services, have those returned to normal? And
yes, pretty well to normal. I mean, dental services, like everything else, sits within those clinical services that also have a huge backlog. And many people will be wondering where the appointment for their children is, for their dental checkup, for example, and the school checkups that we used to do, and bringing classes into the dental services. All of those things have clearly had to stop. We could hardly bring everybody together at the same time during the pandemic, and so of course they're working on a catch-up as well. But dental services, by and large, have coming back to normal as best they can. But we're dealing with a catch-up. So it may seem like people are waiting a long time for their children to have their appointments, or for the appointments for dental, but that's because we're having to triage and just perhaps prioritise some of that early intervention so it doesn't get too late.
In respect of visits to the hospital, let's take first the sort of special circumstances around giving birth. What restrictions are there still in place for the partner of a woman who is giving birth? Yeah,
so it's a really difficult one, isn't it? Because of course we've had all the way through to try and protect everybody within a GHA site. That's the patients, their relatives, the staff, clearly, who are there to deliver the care. I can't afford for them all to go off sick. So we've had to restrict visitation in every single area. One of the really, really difficult ones, of course, is if a woman goes into labour and she needs her partner to be with her, we had to get to the point of restricting it literally to the point almost of the birth itself. And that must have been very, very distressing for both partners. Must have been really, really difficult. But of course we've had to take a very difficult line on that to protect everybody. What's very interesting is when we engaged with service users and women who had been in and had their babies, and their partners, and with the midwives who are basically there looking after the patients when they're there, the unanimous report across the board was that the outcome was better when it was just mum and partner. because the overall atmosphere within the maternity unit was quieter. We found that there was an increased incidence of babies finding it much easier to latch on for breastfeeding, for example. There was a calmer air, babies were less distressed because there was less through flow of people coming and visiting and things like that. So we took that as a very positive, because the crucial point is that baby bonding with mum and with mum and partner, with parents, and the breastfeeding side of it, very crucial. So what we've done is we've kept a little bit of those restrictions, so the birth partner can come in for the whole day essentially, but clearly we're asking people to be vaccinated, to protect themselves, to protect the staff, protect other patients within the hospital. But unlike other areas of the hospital where we've insisted you either have a vaccination or I'm afraid we can't allow you to visit, we're clearly aware that this is a very difficult time to deny somebody visitation. So in that specific instance, if a birth partner is not vaccinated, hasn't had the chance or is unable to, we will still allow them in, but clearly in full PPE.
And tested as well? Or?
We will test them as well, yeah, absolutely, yeah.
And what about at end of life? Are there also visitation arrangements that are possible?
Yeah, of course, yeah. And it's sometimes very difficult to give an across-the-board answer on these, because every single case is different. But ultimately, with people who are approaching the end of their lives and for their families, it's a very, very difficult time, and we try and be as compassionate as we can. But we will try and bring people in where we can. We'll obviously have to make arrangements to try and protect other patients who are in there and other staff who are in there. But absolutely, we'll do our very, very best to bring visitors and bring family in to say goodbye to their loved ones if that's what's happening at that time.
Well, let's bring it back to primary care services, which has been the thrust of this interview, Dr. Rawal. Some final thoughts as we think ahead to the coming weeks for potential healthcare users watching and listening to this.
So final thoughts really are that I think we've been through our surge now, so I think things will settle a little bit. Clearly the message still, even for those people who've been frustrated to get an appointment, the message will always be, please come and see us. Please tell us about your medical problems. We are doing our utmost to provide as many appointments as we can, but please bear in mind that the GPs are working incredibly hard to provide the best level of service that they can, and we are increasing appointment availability where we can. I'm asking my GPs once again to go over and above to provide that, to deal with that surge, and in many cases, I'm just asking for just a little bit of patience, perhaps just to allow us to get that system right again. But we will provide. Of course we will.
Dr. Rawal, thanks a lot for your time.
Thank you.
The Acting Medical Director, Dr Krish Rawal, has confirmed to GBC advance appointments will be introduced for GPs at the primary care centre. When we spoke to him on Friday, he was expecting the announcement to happen this week, but at the time of recording this piece early Thursday afternoon, details had not yet been published. You're watching Viewpoint. Ms Hassan Nahon claims there has been visible and painful cuts within the GHA. The Together Gibraltar leader said any insinuation that problems of access to appointments in the PCC are linked to staff absenteeism is an insult to the workforce that has carried the community through a pandemic. My colleague Cristina Cortez spoke to Ms Hassan Nahon.
What we're seeing in terms of the government cuts and the suffering on behalf of the users in the GHA is not actually the issue per se. It's a symptom of the issue, which is austerity by government. Government is cutting everywhere, and unfortunately they are cutting majorly in our fundamental public services, which is where they should be cutting the least. So we are highlighting that the problem within the GHA and all those people who are seeing a very fast decline in government in health services, this is coming as a result of government cuts and austerity, purely and simply.
Aren't the delays at the GHA to some extent explicable by the backlog caused by COVID?
I think it's fair to say that to an extent that has been the case, and this is why Together Gibraltar has been generous with government in waiting a few months instead of simply jumping on what appeared to be a backlog. But when you see that everything has now practically gone back to normal, that we're ready to welcome tourists, that we're looking to get ourselves on green lists and expose Gibraltar as a center of possibilities post-COVID, the first thing that we should have in order is our fundamental health service. So I don't think the government can ride on this COVID excuse anymore, especially as it's looking to optimize other sectors and industries into the future. This is exactly the opposite of what we should be doing. We should be getting our house in order first, and the first thing to do in that sense is to get our public services, our health service back on track and end these backlogs in order to continue as we need to and as we mean to go on and get up to date with things. So now what we have is not only the backlog, which is a normal, natural effect of the COVID months and pandemic, but a very real situation, which is that the current issues by people are simply not being seen to, not being catered for, and you have people desperately trying to access the health service with very little attention and issues that are causing their own personal backlogs, where they're getting sicker and of iller health and they have nowhere to turn.
In terms of issues such as the resumption of tourism, couldn't it be argued that this is what's needed to boost the economy to help avoid austerity?
Well, I'm sure that the government will spin it that way, but what we need at the very start is to have a decent functioning health service. Imagine what you're saying is true and we start getting these tourists coming in, and then you have naturally a proportion of tourists who need health service. How on earth are we going to deal with that? Just simply that little point, when we have our own citizens trying to access healthcare and getting nowhere and getting sicker as a result. You have stories of people trying to access for 40, 50 minutes, not getting anywhere. People who started off with irritable bowel syndrome, which has now turned cancerous because they didn't get any solutions or any attention. I mean, these are serious issues that have to come before any build-up of government coffers or any tourism or any great, bright marketing advert that we might put out in the UK or abroad. This is serious stuff that needs to be addressed now. And when we're seeing the signs of austerity and cuts across the system, when we're seeing that supply contracts aren't being renewed, when we're seeing that vacancies aren't being filled, and when we're seeing that doctors are completely burnt out after the year they've had because they're being stretched to the limit because vacancies aren't being filled, we know there's a serious problem of austerity which is facing our health service.
You say there have been cuts at the GHA and that this, not staff absenteeism, is responsible, for example, for the lack of appointments at the PCC. Can you give more detail?
For the government to pass the buck, launch an investigation and blame the GPs who we have relied upon, who have carried us through this pandemic in the last year and who are breaking their backs trying to maintain the health service with all the cuts that we are seeing, I mean, it's absolutely shameful, it's insulting, and it's ungrateful to say it as kindly as possible. And from my part and the part of my party, I want to apologize to these doctors for being treated the way they are. And I think that the government needs to take ownership and responsibility for their own policy and stop blaming others and deal with the situation and help the innocent citizens of Gibraltar who need attention instead of passing the buck on the doctors who have saved the day in the last year.
You've accused the Chief Minister of lying on this and other issues throughout his tenure. This is a serious accusation. How do you justify it?
What the government can't do is say 1 minute that everything is fine and dandy and that COVID, yes, has affected us, but we still have plenty of reserves and there's no problem at all. And on the other hand, cut on our most fundamental services and have people suffer as a result of these cuts, which apparently really wouldn't be needed because we were doing so well. So, of course, there is a lot of opacity, shall we say, in what is really going on, and I think the people of Gibraltar deserve a clear explanation.
Together Gibraltar leader Marlene Hassan Nahon speaking to Cristina Cortez. And the Chief Minister replied to Ms Hassan's comments. He said there's no question of spending cuts to health services over the next financial year. Fabian Picardo said the estimates of expenditure for 2021-2022 demonstrate this. The estimates have not yet been made public, but they have been circulated to MPs. My colleague Ros Astengo spoke to Mr. Picardo.
The Chief Minister of Gibraltar is not lying to the people of Gibraltar. This has been a very difficult year. And what we've done is say to the people of Gibraltar, at every stage, you're going to get the truth from the government of Gibraltar, however uncomfortable. And in the context of spending in respect of the health service, as Ms Hassan Nahon actually knows herself, there is no question of spending on the health services being cut in the next financial year. Look, the government has already handed to all members of Parliament this document. These are the estimates for next year. They are confidential until we start the debate in the House for the budget in summer, just before the summer. Ms Hassan Nahon knows what's in this book, although we cannot disclose it. She therefore knows that when we start to have the debate and the numbers become public, what she has said will be demonstrated to be untrue. And I'll tell you more. In the last 10 years, from 2008 to 2009, when we were not in office, to now, to the last published figures, we have doubled the amount spent on the health service. We've gone from 60-odd million pounds to near 130 million pounds spent on the health services available to every Gibraltarian. I think that's money well spent. We need to ensure that we spend it right, that we spend it well, and that where there is, as ever, we have to ensure there is no waste, but it is the right amount to spend. We're not cutting the cost of the health service. We've increased funding for the health service. The opposite of what Ms Hassan Nahon said yesterday.
Together Gibraltar claim that cuts are being made now. They may not be direct cuts, but a reduction in the number of staff by way of not renewing vacancies. That's austerity by the back door, surely.
Well, but for goodness sake, you've got to realise that we are in a situation where we've just been through a global pandemic. So the world is still in the throes of this pandemic. Recruiting for the health authority is sometimes something that has to happen internationally, not just locally. So of course, in the health authority and in many other departments in the government and in many private enterprises in Gibraltar, in many private companies, recruitment is not what it would have been in other years. But it is absolute nonsense for Ms Hassan Nahon to suggest that the government is not investing in our health services. We've put more people on the front line in health, more doctors, more consultants, more nurses. That's what a socialist government does.
So why haven't GHA services returned back to normal as yet, by your own admission in your press statement yesterday? You've been on television saying that Gibraltar welcomes tourists now and that Gibraltar's open for business. So why hasn't our GHA returned back to normal?
No. Let's be very clear, Ross. We have not got tourists back. We are planning to have tourists back, probably from the 17th of May. They're not here yet. We are going to have the health services back to normal, but we haven't yet got them back to normal. Why? Because you've got to realise, as everybody realises who is reasonable and who understands the way that humans work, and government is an organisation made up of humans, nothing else, that you cannot go from one mode to another as if you were flicking a switch. The public sector in Gibraltar has delivered a magnificent response to the past 14 months of the pandemic, including in particular the health services. As we ramp up from that response to the COVID pandemic to what we would call the day-to-day operations, we cannot have that happen like this. It would be, in my view, unfair and to lead the public up the garden path for Ms Hassan Nahon to pretend that she could have transitioned the GHA from the pandemic response to what we might call normal operations in a tighter or easier way than we are seeking to do in order to ensure that the general public have the service that they need from the GHA as from all the other departments of government for which we are responsible.
So by way of clarity, you don't intend making any cuts at the GHA and you do intend filling those vacancies as they come up?
Look, we're going to be seeing some consultants come to the end of their contract, and we're going to see those consultants replaced. We're going to be seeing some GPs, I assume, retire, come to the end of their contracts. We'll, of course, be seeing people recruited to fill those posts. There's no question of us not continuing to have the numbers of people that we need to have on the front line to provide the health services that this community deserves and expects. We have a very clear commitment to the complement of the civil service as it was when we were elected, a complement that we have have exceeded since we were elected. I am an anti-austerity politician, and it is not true for Ms Hassan Nahon to suggest the opposite. In fact, as the numbers will show, and as the bill will show, and as the estimates will show, we will be increasing spending in respect of the health authority and not reducing spending.
By your own admission, there has been waste and abuse in the public sector. Can you put a figure on that?
It's impossible to have a figure on that. What we're trying to do is to say that in every department we need to ensure that all of the good apples, who are the majority who are delivering the service, are not in any way let down by any bad apples that are wasting or are abusive. And this happens, unfortunately, in every organization. You have people who let down the organization in the private sector and in the public sector. We must root that out now, because we must ensure, as we find ourselves in the situation that every country in the world finds itself with its public finances under considerable pressure because of the pandemic, that we don't allow any leakage from our public finances in respect of abuse or waste.
Why has waste and abuse been allowed to happen in your watch? You've been in government some 10 years now. Why have you allowed that to happen?
What I'm telling you is that waste and abuse is something that you have to constantly be looking at. And I'm telling you, it's not just in government, but in every organization, that you have to constantly be dealing with the issue. We have been fighting against abuse and waste since we were elected, and we will continue to do so. But in particular, we will do that now because of the pressure on the public finances. Of course, we've been in government for 9.5 years. And not 10. I know that time flies when you're enjoying yourself. But we have to ensure that we get it right every month. And these 12 months of this financial year will be more important than ever. And my challenge to Roy Clinton, to Ms Hassan Nahon, to Keith Asopali, and to everyone else is to say, what, apart from the music festival, what would you not have spent the money on?
The Chief Minister, Fabian Picardo, speaking to Ros Astengo. That's where we leave Viewpoint tonight. We'll be back at the same time next week. Thanks a lot for watching, and good night.